evening, everyone. Welcome to this special edition of our Texas AFT Webinar Wednesdays as we kick off National School Safety Week. My name is Zeph Capo, and I'm the president of the Texas AFT. And as you know, we wear red on Wednesdays to highlight our advocacy for school employees. Today, I'm honored to wear red from Socorro AFT, and as they give tribute to Rosie, I want to also send a shout out to our staffers in Socorro AFT, our Rosie staffers, and our leaders on the executive board there. Thank you for everything that you're doing. We are thinking about you as El Paso's numbers with COVID continue to climb, as it does in other parts of our state that we're working to try to control. So today I'm honored to have a powerhouse panel from the Greater San Antonio area. With us today is State Representative Roland Gutierrez for District 119, who was our endorsed candidate for the Texas State Senate in District 19, and we'll hear more about that in today's broadcast later. Additionally, my colleague from the San Antonio, Alejandra, thank you for being with us this evening.
Thank you.
As well, we have Dr. Sharice Rohr Allegrini. Dr. Allegrini is the CEO of the San Antonio AIDS Foundation, and she recently served on the transition team for the city of San Antonio, the public health transition team, as we're working through the COVID pandemic. Welcome. So I'd like to start off with you. If you could or wouldn't mind, what are the main pieces that an epidemiologist does for us, and how can an epidemiologist, what is it that you do?
So an epidemiologist is someone that looks at diseases in a population. I always say that if you go to a doctor, your doctor is looking at you as the patient and wants to make sure you get well. The epidemiologist wants that also, but we want to know who got you sick and who you might give the disease to, and we want to try to prevent that from happening. So we work a lot in prevention. And so with COVID, we're learning a lot of things about COVID. We're learning as we go along, and our role really is to try to prevent the spread and intervene in the spread. As we learn things, we learn about how it's transmitted, we learn changes in how it's transmitted. We want to identify people that you've been in contact with so we can stop the spread. And then we analyze all the data too. So a lot of people think of us as number crunchers, and that's a part of it, but a lot of it is understanding the community that we're working in too, so we can prevent the disease.
So we've talked a lot about social distancing. Masking and social distancing is two of the most important factors in helping to control the disease. And we certainly hope that everybody is properly masking as they're coming into schools. But I want to get to social distancing for a minute. How did we come?
And I know social distancing is the term that we've been using for a while, and we were really trying to change that to physical distancing, because we don't want you to not be social. We want you to create a physical distance, because that's what matters. And the Viking droplets are coming out. And typically they don't travel more than 6 feet. It's usually less than that, unless you're singing or shouting, but it's usually less than 6 feet. More than 6 feet away, you're not likely to breathe it in. If you're closer to the other person, you're likely to breathe it in. Now, it's not perfect. We know that the COVID virus can hang around in the air for longer than we thought. And that's why masks are really important, because they help to prevent us from those droplets coming out, as well as preventing some of the droplets from coming in.
Well, those are really important factors. And I know that it's one that's come up so very often in many of our schools and school districts all throughout the Houston area and Dallas. Alejandra, how are the schools doing in San Antonio? Are they able to provide 6 feet of social distancing between the desks?
So at the moment, it really depends on the school district, and all school districts, of course, are going to tell you that they are implementing physical distancing protocols. However, as a second grade teacher, I can tell you right now, I mean, second graders don't know what 6 feet is. That's something we teach them in second grade. So really the question is, how effectively are these protocols able to be implemented? And so, for example, in our district, we are currently only at 25% of student enrollment in terms of capacity in our classrooms. That's something that our union, along with the coalition, organized around in terms of really pushing districts to adopt the guidelines set forward by Metro Health that take into account kind of objective metrics when it comes to talking about how many students should be let into our schools for face-to-face instruction. So the fact that we have such small class sizes at the moment mean that, yes, students are able to be 6 feet apart. However, the challenge comes when you start to add more and more students. And so that's why it's so important for districts to really stick to those objective metrics that have been laid out. So that way we're not in a position where students are being added at a rate that is kind of too fast for the conditions in the community at the time.
That's a really great point. And unfortunately, many of our districts have tried to implement or have had developed these policies as part of their return reopening plans. Unfortunately, TEA has mandated that all parents who want to return their kids to an in-person school should have an opportunity to do so. And this is the unintended consequences of this are playing out in schools that were already typically overcrowded before COVID, or have served communities that for one reason or another are more likely to want to return in person. So we have several of our schools that have started off at 6 feet, but as President Lopez said, we once those students start coming back in bigger numbers, the social distancing space starts to shrink. And many of our members out there, Dr. Rohr Allegrini, are concerned about that. And so they really want to know, what is the risk level? What really is the risk level when you're looking at more like 3 feet of social distancing?
Well, it's complicated, and I can't give you an exact number. This is why those other measures are so important: the mask wearing, hand washing, etc. But really not crowding a room, because not only do you have less than 6 feet, you've got more people in a small space. So you're more likely to have somebody that's infected every time you add another person, and you're in an enclosed space. So if you're outside, I'm going to worry less. But if you're indoors, that air is trapped there. You don't have a lot of airflow. You are now having 10, 15 kids breathing out, potentially causing a spreading event. So it's really concerning. So that 6 feet matters, not just because of the physical distance that we're creating, but the number of people in a room and the likelihood that the virus is going to survive in that room for longer. And so it's going to be really important to stick with those guidelines for as long as possible. And I know it's hard for some schools to do that.
Alejandra, what are you hearing from your members that are their major concerns about returning to school, particularly as they start looking at the fact that more kids may be coming in?
Yeah, so, in our district, we did have kind of this mandate by our district leadership to have 100% of teachers come into the schools, even though the vast majority of teachers are teaching 95% of their students online. So it has been, unfortunately, teachers from the very beginning were worried just about the number of people that were going to be on campus. And of course, we're hearing from members about a number of different things, everything from high quality PPE, right, in terms of what is being provided, to ventilation. As we learn more about the virus, like Dr. Rohr Allegrini said, as we learn more about airborne transmission, there is a really deep concern that the ventilation systems within our aging schools are really not up to the task of keeping the air purified and clean. Our district is an inner city district. We really kind of, struggle to get the adequate resources that we desperately need from the state, which of course is not by accident. So, teachers are looking around at their classrooms, at the schools that haven't been upgraded, and thinking, is this air really, pure, and is it going to potentially get me sick?
Now, your advocacy wasn't just your members. You alluded to earlier, you and Dr. Roar Allegrini were part of a coalition. Can you talk to us about that coalition and how you think it's actually impacted your return policies?
Sure. So yeah, here in San Antonio, we knew that school reopening was going to be a concern and a question, even at the end of last school year. So even before, Metro Health or our city leaders started talking about school reopening, those of us that are on the front lines came together. So we brought together other union locals from throughout the city, public health experts and parents, and most importantly, students who are so often left out of these conversations, and really started to put together what school reopening should look like. And one of the very early things we started talking about was these objective metrics, right? That meant that districts were going to take into account what the transmission in the community looked like in order to determine if and when schools were going to reopen for face-to-face instruction. And then from there, how many students were going to be allowed to come in for face-to-face instruction. So we took very much a community organizing approach, ensuring that people had, the adequate information around COVID. We hosted several town halls with members of the coalition and also elected officials. And really what it boils down to is this is a public health issue, which means that we are all in this together, right? When we advocate for safe schools, we're advocating for the workers in those schools, for the students in those schools, and for the students' families, because the way that this virus really operates is that it doesn't just infect one person. It's entire households that go down with this virus. And what we also know is that this virus affects our Black and Brown working class communities at much higher rates than it does other communities. So for us, we felt like we had a responsibility to really ensure that schools were opening in the safest way possible to keep ourselves and others safe.
That's a really great point, and one of the main reasons that proper testing and contact tracing is so important. Dr. Roar Allegrini, can you talk to us a bit about how contact tracing works, and in particular, thinking about the school setting? When we find out about a positive case or multiple cases on a campus, how should or what should employees know? How should they respond to that news?
Okay, well, let me start with contact tracing. This is how we prevent the spread of the disease. Remember, I talked about that earlier. That's what an epidemiologist does. So when we have someone who tests positive, we ask them who they've been around, what classrooms they've been in, who their friends are, who they've spent time with. And we're really trying to determine who's in close contact. So if you were at HEB for 20 minutes, you probably weren't in close contact with anybody. But if you were in a classroom all day, you probably were in close contact. So we're really looking for somebody that you've spent more than 15 minutes talking to within 6 feet. Now, the CDC says it doesn't matter if you're wearing a mask or not. If you're 6 feet for 15 minutes, we're going to call you a close contact. Again, the masks help, but we're just going to be safe in that regard. So it's important that the health officials help you through that, or at least training the staff to know that, to understand what close contact is. Because some people will say, oh, we need to notify the whole school has to be quarantined. But really, it's just those folks that have been in contact. Now, a school situation is a little different than a normal general public situation, because you do have a group of people in the same room for a long period of time. Now, if everybody is following all the proper protocols, which means 6 feet apart for all the time, and wearing a mask 100% of the time, then in theory, nobody's going to be in close contact. But we know when people say they're wearing a mask all the time, and it's not that they're lying, but the mask probably came off, or that, oh no, I didn't get close to anybody, but there's a good chance, 6 feet versus 5 feet, you start moving close together, you're not paying attention. We all do that. And so we need to consider potentially expanding that definition when you have a congregate setting, and that's really what a school is. Now, we think that most kids at least are low risk unless they have other health complications. So it's a little different than, say, a nursing home. But still, it's a congregate setting. You've got a group of people in a single room for a long period of time. And so what the school needs to do is identify those individuals that they would say are in close contact, notify them. Whether or not they need to quarantine depends a little bit on the level of contact. If somebody walked in the room for 10 minutes and was gone the rest of the time, I probably wouldn't tell them that they had to quarantine. But for the other kids in the room, I probably would. Now, again, it depends on what level of contact there was. And it's complicated because soon you'll be quarantining the whole school, and that's not practical. So this is why you really need to work with the health officials to go through the process with each case. But that's where you need to start. Make sure you've notified all the people that are in close contact so they can do the follow-up testing, so they can do the quarantining if that's warranted. And also, if they're high risk, then they know what things to look for. The other thing that the schools need to do is make sure they're communicating that with the entire school population immediately. Now, what often happens is folks, they want to know everything. You can't know who was infected. You can't know who's involved. That person has a right to their privacy. But what the school needs to tell you is, we've identified a case on our campus. We've notified everybody that's in close contact. And so if you haven't received a notification from us, you can make the assumption that you were not in close contact. You are not at risk. That requires trust. That requires that you trust your school leadership to be completely transparent and honest. And the way to build that trust, again, is to be transparent from the very beginning. The school leadership needs to let you know what the process is. They need to be able to explain that to you so that you can feel confident when you do receive that call that they've gone through the whole process and indeed I'm not at risk. But if that information isn't conveyed to the community in a way that the community can understand and feel confident about, they're going to question you. And that breakdown of trust is what causes a lot of the complications in public health.
That's such a great point, because there's been far too many concerns that we've heard most recently where school employees have not found out from their school about a COVID positive person. One teacher reported that she actually had to find out from her colleague, who she had had lunch with all week, had worked with in close proximity, but wasn't notified by the school that they didn't meet the definition of close contact by the school. So that's maybe part of the tricky issue, is how do we find out that we're actually defining things in the same way? Like
right. Well, exactly. And the CDC has a definition of close contact, and individual health departments might vary a little bit about that. And the school might follow the local health department's guidance, or they might have a stricter version of that. And whatever that is, they need to let everybody know that this is how we're defining close contact. And then you can say, okay, I'm comfortable with that, or I'm not comfortable with that, and maybe we should make some changes. That's going to be an internal decision to make. But that's part of that process that needs to be clearly explained to the community.
Absolutely. Alejandra, the process of contact tracing and having these really hard discussions at times often creates space and opportunity and the need for our leaders, our members, to speak out over safety concerns. What are some of the potential consequences, and how are we standing up for our activists and those who do speak out?
Yeah, thanks for the question, Zeph. This is such an important issue, right? We are in the middle of a global pandemic, of a public health crisis, right? We've lost over 215,000 people in the United States to COVID-19, right? We have a collective responsibility to one another to do everything in our power to keep our communities safe. And the strong thing about unions, right, is that is the framework that we operate in, day out, right? The power of the union, the power of our union is in our collective voice and our collective action. So, we've been working with members at their work sites throughout the summer and into the start of this school reopening to ensure that they have the tools that they need to organize effectively. And unfortunately, this has been met with resistance in our district from district leadership and, campus administrations. And I think the most extreme example of this is essentially union busting, right? We had a building rep, a steward at one of our campuses who spoke out in a faculty meeting, just as we all do, right? Faculty meetings are shared spaces. They had questions about the safety plan. Other educators and staff members also spoke up with their questions because ultimately they felt that the safety plan for the campus was not adequate to meet the needs of the students and of the workers that were going to be in the building soon. This leader was then questioned extensively about his union activities and a violation of his First Amendment rights and put on administrative leave, all for really just speaking out and voicing his concern and the concerns of others around safety at their school. We were there right next to him. We filed a grievance because it was such a clear violation of his First Amendment rights to organize within our union, and got so much support, not only from Texas AFT and our wonderful legal counsel, Martha Owen, but also the community. We had community members, parents, students, really voicing their concern that this action was taken by district leadership. And it really shows that in a time like this, this is a community issue. Public health is a community issue. And, because this member spoke out and because his colleagues spoke out, that campus ended up with a much stronger safety plan than other campuses did, because they stepped forward and said, no, we are not bringing students into this building until it is absolutely the safest place that it can be. And so, that is just one example of why it is so important that this be a collective effort to organize around safe schools, to demand from our district leadership and our elected officials that we be given all the resources we need to ensure that workers and students and their families are safe.
That's a great point, and it really does send home the importance of engaging your community, of building relationships and trust with your parents, with your students, with many of the community leaders, the nonprofit agencies. Imagine where you would be if you didn't have that support from the community to be able to speak out, because we can't do this alone as educators. Frankly, we shouldn't have to do it alone. We've done it alone too long. So, Dr. Aurora Allegrini, I'll go back to you. Some of our schools and some of our educators are just returning back to work. What really should they be focusing on, educators, students, and parents, to protect themselves and be safe while returning to the classroom?
I would love to say they should be focusing on what they do every day, which is educating our kiddos. Unfortunately for our teachers and our staff, they have to focus on so many other things. And that's making sure that your classroom is set up to be as safe as possible, that it's not a problem to follow the right protocols in terms of that 6-foot distancing, that mask wearing, making sure that there's an option for wearing the mask. You've got extra masks there in case a child comes with no mask. That kids have mask breaks, which means going outside and keeping them distant, but having, sorry, my son's in the background playing a game and he's distracting me. Keeping the kids distant when they are outside, but those mask breaks are actually really important because it's hard to wear a mask all day and we want to take it off. So if you've got mask breaks, that means that the kids are less likely to take it off in class. Making sure that your room is set up so that it's easy enough to keep that 6-foot distance, and talking to the kids about why it's important, why they need to follow it without fear, without scaring them. It's a game that we play, or it's, you're contributing to the community by following these procedures, and making sure that your classroom is set up with the right PPE. And it's so important to have a good relationship with your leadership, and I know not all schools do. I'm really grateful that my my child's at a school where I feel 100% confidence in the leadership of the school. I'm in the same district as Alejandra teaches in, but I'm just thrilled with the leadership at my campus. So I feel very confident. But I know that's not the case for all. And so maybe those teachers in schools where they do feel really comfortable can reach out to teachers from other schools. And I think that's a lot of what the coalition does, to help them and guide them, answer any questions they have or find resources for them.
That's great work. And Alejandra, speaking, like you've heard these ideas that can help keep our members safe and help keep our students safe. What ideas do you have on how the administration and the staff can work more cohesively to ensure that we're putting these ideas into action and practice?
Yeah, I think, Dr. Royal Allegrini made a really good point when it comes down to trust, right? And for us, transparency and trust are really, interwoven with one another. And so I think when it comes to district leadership, district administration, there really has to be transparency around decisions that are being made, particularly when it comes to the COVID protocols and the COVID cases, right? Because we know that COVID is still in our communities. And that's another point that I do feel is important to note, right? Unfortunately, we're in a situation where the idea that we would continue with online learning is really not something that we're entertaining because of the economic pressures that so many of our families face, right? And I know that it is, something that we should not overlook, right? The fact that our families are dependent on the work that they do and do need, spaces for their parents to go. I mean, for the children to go during the day. But I do just want to, note that that is a political choice, right? That our society has decided to not prioritize getting over and through this pandemic in a way where people can stay home and stay safe. So I think it's always just so important to note that this is the situation we're in, but it doesn't have to be this way. There are, alternatives to the model of just reopening for business, but it takes the political will to do that, right? And unfortunately, at the moment, we don't have many people in power who are willing to take those necessary steps that would mean that people got to stay home and stay safe and not put themselves at risk by having to go out into the workforce. So, for me, it's always important to remember that, there are different possibilities there than the ones that we're living through at the moment.
Absolutely. Absolutely. Thank you very much for sharing some time with us and sharing your stories, particularly about the coalition and the work that you've done to help keep your community safe and the advice that you can offer to others. I want to stop for a couple minutes. We've got some questions that have come through, and some of the questions I think we've answered through the conversation so far today, but there are a couple of them that I think most people have on their mind. And this question comes from Becky. When is it okay for someone who tests positive to return to the classroom?
So it depends on if they have symptoms. If they have symptoms, we need to wait generally 10 days after their symptoms start, assuming the symptoms have resolved by then. If they're still having symptoms, they need to stay home and they should be under the care of a healthcare provider. But generally, if they're mildly symptomatic, 10 days from the start of the symptoms, they can return, provided that they have no more fever or cough. But they do need to stay home for that time. Then that's different. Let me clarify something. It's different from the incubation time. A lot of people also hear 14 days and they hear 10 days and they're confused about that. 14 days is the quarantine period because that's the incubation period if you were exposed. You don't know that you're sick. It could take as long as 14 days for you to get sick. And then you isolate for at least 10 days or until 48 hours after your symptoms have resolved.
So there's a follow-up question to this. It comes from Virginia in Sci-Fair, and so it relates exactly to your answer. She had a student, two students that left because they were COVID positive, and they returned in exactly 10 days later. I'm assuming that that could potentially be something that could happen. Maybe they were asymptomatic.
Right. If they didn't have symptoms, then they could return after 10 days. Or if those symptoms were very mild, it's really, it's not 10 days after your symptoms resolve, it's 48 hours after your symptoms resolve. So that could be 10 days. And I'm going to guess the students were not very sick, and they should really be cleared by their healthcare provider when there's a healthcare provider available, which we know is a challenge for many of our families.
Thank you. This next question is from Maria, and Maria says, my school said in August that students were supposed to wear a mask at all times except in the cafeteria. Suddenly, they're allowed to eat, drink in the class and totally remove their mask until they're done. It is district policy. I'd like to know, how can this possibly be safe in a room of 26 to 30 kids without the ability to physically distance? I do not feel safe, and I'm wearing a face shield now on top of my mask, washing my hands between each class.
So, and I would love to have Alejandra come in on the union side of this. It's not safe. So this is one of the challenges with restaurants, and restaurants, it's not that they're necessarily super spreader locations, but you have a lot of people in a small space and they're taking their mask off because they're eating and drinking. So if you have that same environment in a classroom, and if you've got 26 kids in a classroom, I don't know of any classrooms that are big enough to have 26 kids physically distant 6 feet apart from each other, then you're creating a risky situation. Now, a little bit depends on what the infection level in the community is. We weigh that in determining how likely one of those students is going to be infected based on that infection level in the community. But I will say across Texas, almost every community has a high level of infection right now. So it's not safe. I would recommend they go outside to eat, or at least in a cafeteria where they can spread out much more. But I'll let you weigh in on the other helpful parts of it.
Thanks, Sharice. Yeah, and this goes back to the fact that these are political choices, right? We know that here in Texas, that unfortunately our governor and our education commissioner, right, have decided not to prioritize community health. And to instead prioritize the interests of, business owners and the wealthy who are already seeing, astronomical, wealth, and then are actually making a profit in many cases during this pandemic, right? So unfortunately, our elected officials at the top level are not prioritizing community health, and are creating these situations where unfortunately schools are essentially allowing too many children in, right? I mean, that is the situation. And I know in our district, we do have, like I said, we're at 25%. And the question then becomes that if they continue to add students, how are they going to ensure that they can physically distance? And the pressure point of this is in a place like a cafeteria, where a cafeteria is a large setting, but still it's just math, right? If you have X number of kids and you need to keep them 6 feet apart, then you can only fit a certain number of kids. And that comes in conflict with scheduling, right? Which is probably the reason why this district has decided to just mandate lunch in the classroom, right? So again, these are just choices. These are choices that are made by people in leadership positions that put students and teachers and other staff members, custodians who have to go in there as well, at risk. And really what needs to happen is people need to say, no, enough is enough. And that is where the power of organizing really comes through. I'm sure that the parents, I'm actually not sure, because I know there are communities that are reacting to this pandemic differently. But, parents, for the most part, don't want to put their children at risk of contracting COVID, or of a child bringing COVID back to their household. And if they, know kind of how risky this situation is, then my hope would be that members of the community would really come together and say, this is not safe and this is not what we want this to look like.
And I think your answer that you just gave basically acknowledges the question that Angela had, and I'm just going to leave with a statement of Angela's question as we move into the next segment, which is the segment on school safety being on the ballot. And Angela asked if businesses can be fined for not following health guidelines. Why isn't there something similar for schools that have larger groups of people? And we'll ask State Representative Roland Gutierrez that very question when we return after this video. Ladies, thank you very much. We invite you to stay on for the second half if you would like to. If you need to go, we understand. And we look forward to talking to you soon. Thank you for your information earlier today.
Thank you.
Great. Thank you.
Good evening. If you're just tuning in, my name is Zeph Capo. I'm president of the Texas AFT, and I've been speaking this evening with Alejandra Lopez, the president of the San Antonio Alliance, as well as Dr. Sharice Rohr-Allegrini, an epidemiologist in the San Antonio area who has been phenomenally answering our questions on health-related matters. We're honored to be joined now by State Representative Roland Gutierrez. Representative Gutierrez is our endorsed candidate for Senate District 19. So we hope that all Texas AFT members that are eligible to vote in that district, if you have not gone out and done so already, please make sure you do and check out State Representative Gutierrez's positions on education. But we'll have an opportunity to talk with him tonight on safety issues. And I think that you were listening in the background to our last question that came in from Angela. And her question was, if we have systems of enforcing policies or enforcing guidelines for businesses and others, what can we do to actually have some enforcement level for our public institutions like schools, where we want to keep students and others safe? Any responses, State Representative Gutierrez?
Yeah, so first off, thank you, Zeph, for having me tonight and having me on the show tonight. And Alejandra, thank you for all of your support from the Alliance and everybody out there, all of the teachers at AFT that are supporting our candidacy for Texas Senate District 19. It is our hope to be able to not just win this seat back, which is clearly a Democratic seat through all of these years, and it was won by Mr. Flores in a special election. But it's also our hope to win the House back. And so it's really incumbent on the 370,000 plus teachers to get out and vote and create change. In answer to your question, about enforcement, I can speak to what's happening here locally here in San Antonio. Our city and county leaders are doing their part to try to create enforcement regimes, enforcement rules, if you will, that allow people to do the right thing and try to stay healthy. And our mayor's done a very good job, our county judge as well. But unfortunately, when you don't have the same kind of support, if you will, from the next level of government, which is the governor's office, certainly the president of the United States, it becomes a problem. Since when did wearing a mask become a political statement? Since when did it become an IQ test? The most obvious of things. I mean, I have friends in China, and I ask them, well, how have you guys done it? You've gotten through this. And they've said, look, we're different. We're actually afraid of COVID. And so we are all afraid of COVID as well. I'm sure everybody listening here tonight. But we have a political structure in the United States right now where somehow this has become some kind of civil liberty for some people. And at the end of the day, it's really just about health. 20 years ago when I was a young man, they passed laws to wear a seatbelt. And now everybody wears your seatbelt. Makes sense. And so we could have done a better job here. I asked the governor and the lieutenant governor, and I wrote a letter to all of my colleagues that we needed to do mass testing and mass tracing, and that hasn't been done. So the city, I tell people this all the time, the city of New Delhi, India, has 29 million people. They tested 29 million people in 10 days. We can't do a fraction of that, not a fraction of our state's population, not 1% in 10 days. And so we've got a real significant problem in leadership, and you just have to ask everybody to go vote. I mean, this is really, truly, for the first time, one of these times when you really have to vote. It's about voting for our lives. I mean, it really is. Sounds dramatic, but it's true. At the school level, when it comes to safety, the CDC has protocols, and those protocols, you guys have been talking about them, earlier in the session. And our teachers and our school boards and our superintendents are doing the best they can, but you're given no support by the state. Where's the CARES Act money? And where is it going down to supplement infrastructure in our schools? Where's the CARES Act money when it comes to giving schools infrastructure money for HVAC systems that need to be replaced, that can, help, with better filtration and such? Where's the CARES Act money when it comes to, having the appropriate PPE and dividers and the plexiglass and everything from desk to desk? It's not here because, the governor is using it to continue funding education, which is fine. But we also have rainy day money for that. And so we have to be real particular and really understand that this next session. I had an event with my opponent the other night, which is one of the few times he's chosen to debate me, because he's refused 2 other debates. And he said to the folks, well, in 2009, of course, he wasn't in the legislature. He says, Governor Perry got us out of this mess. I was very quick to remind him that in 2009, it was Barack Obama that sent $16 billion to the state of Texas, at which time we in the legislature put that money and gave it to our schools. We plussed up education a bit. And yet in 2011, 2013, 2015, all of those gains were erased by Republican policies that essentially eradicated all of that additional funding that we got in 2009. And so school districts who had put in pre-K programs or ESL programs were left holding the bag. And so I use that as an example to state that the people that are in office right now, the people that are in power right now, are very short-sighted, and they're not planning for the future. We can't be talking just about COVID. You got to talk about the next thing. And so we have to have our infrastructure, our safety, school safety infrastructure to talk about the next COVID. I'm confident that we're going to get through this. I'm confident that we're going to have a vaccine that makes sense, God willing, early next year and into the summer. But we have to prepare for the future, and we have to do better in education. We have to do better for our teachers. The last thing that I want to say on this is, where is the leadership from our state government that says, oh, well, let's just open up our schools. The kids don't get sick anyway. What about our teachers? What about teachers that have families at home? And, what about, we lost a friend, my wife and I. She was 44 years old to COVID. Her daughter went back to high school. And I'm not putting this on the daughter. God, she doesn't need this for sure. But the whole family got sick, and it could have been mom, or it could have been, anybody that got it. But their mother, who was a friend of ours, she passed on. She's 44 years old. This happened a month ago. So this very notion that, oh, kids aren't going to get it, that is the kind of, and I'm going to say it, that's the kind of bullshit leadership that these guys are spewing at the very top level from Donald Trump, and the Republicans everywhere down the line have exacerbated and promulgated this fallacy. And, it's high time that we stop seeing teachers as teachers, and social workers and nurses and doctors and first responders and everything else. I mean, you've had to take on so many things, and it's not fair and it's not right. And we have to be able to acknowledge that at the state capitol and do better for you. I happen to think that our team is better and smarter to do that. I think that we've been doing that. Unfortunately, we haven't been in control in the last 20 years, and we need to change that.
You made such a great point that puts things in perspective when you compare what other countries that have far fewer resources than we do. They could only dream of having the resources we have available to us in Texas, which outstrips most countries in the size of their economy. However, instead of focusing on that infrastructure to get the testing, we have our indicted attorney general issuing opinions that scare school districts from working and collaborating with their public health departments. The actual individuals that you were just recently talking about trying to enforce proper safety standards and control the disease. What can we do to change this? Is there particular legislation? And surely getting out and voting their friends out of office is the first place to do that. But do you have any ideas on legislation or other things that we can do to move the needle?
Well, listen, I can tell you as far as infrastructure is concerned, if there's one thing that's going to happen next session, God willing. My hope is that Joe Biden is the president of the United States.
Ojalá.
Ojalá. That's that. That's exactly it. And it is my hope that he's going to do what they did in 2009, him and Barack Obama. And what they did was they sent Texas $16 billion, as they sent every state a proportionate amount from the relief that was necessary to get out of, the worst recession that this country had ever seen up until now. And so here we are again. For a different reason, not an economic crisis, but a health crisis that's turned into an exacerbated health crisis that's turned into an economic crisis as well. And so we're going to need a stimulus that this Congress right now and the Senate just refuses to pass. And so from a perspective of why vote, yes, I mean, the answer number one is always vote, and vote blue, to be honest with you. But I do believe that we are going to, God willing, get Joe Biden in there, God willing, get a stimulus that makes sense, and make sure that we get stimulus money from Washington that gets directed to our schools, gets directed to our primary education facilities for infrastructure. Because how dare they say, well, go out and, pass a school bond to fix your air conditioners. One of the biggest health issues right now with COVID in schools and infrastructure is the filtering systems in your ACs, and especially in your older schools. And yet you've got folks at the, in leadership in Texas here telling us that that's a bond issue. I mean, really? No, we need new ACs. We need new filtering systems that would be able to help us along the way in this. So absolutely, I think that what can be done from a legislative fix is getting stimulus dollars from the federal level and appropriating the right way. And by the way, so let's talk about a state fix. I'm the only candidate that's running in this race, and probably in a lot of races, that has a plan for creating 60,000 jobs in Texas and creating $6 billion in new revenue. And not every teacher is going to like what I have to say, but 33 states have legalized cannabis. There's a few more along the way. And so every state around us has legal cannabis. Legalize it and generate $3 billion.
Yeah.
Does that make sense?
Absolutely.
And so we're going to have the biggest shortfall that we've seen in Texas in the longest time, right around the corner. And because of COVID, insofar as sales tax revenue, severance tax revenue, you name it, every receipt that you could imagine is going to be hit. And yet, my opponent just says, well, we're going to have to suck it up. No, I mean, that's just bullshit. I mean, we have an opportunity to create new revenue streams in cannabis and generate $3 billion. A pretty fine Republican who's now passed, his name was Edmund Kemple, in 2009 had a bill for 13 destination resort casinos. We didn't want to see 8-liner rooms or a casino in every corner or anything like that. Just 13 destination resort casinos would have generated $3 billion in taxation revenue. And so I'm not a proponent for gambling, but I also don't think that we need to be able to legislate morality. But it just so happens that in those instances, every state around us, every state has legal cannabis and legal gaming. And so what are we talking about? That's $6 billion that we can recreate next year. I don't know if there's going to be any money for anybody to go gambling, but at the end of the day, it means jobs and revenue for the state of Texas, which means not raising people's property taxes. And the other side, by the way, cannabis polls 75% amongst Democrats, about 60% with the Republicans, and yet we have a Republican leadership telling us, oh, we need to see more science on that. That's just a bunch of crap. I mean, we've seen it already. And so there's legislative fixes there out there, and I think that we can get to them if we get leaders and people that are interested in finding solutions to problems. I come from a city council perspective. I'm an immigration lawyer. That's my day job. But when I was on city council, I had to fix the potholes. And so, but more than that, we brought about a brand new library for our community. We created Texas A&M in South San Antonio. We were part of the process of bringing Toyota to our community. I think that leaders have to be transformational leaders and not just rubber stampers. And what we have now is a rubber stamp for Dan Patrick and Pete Flores. We can certainly do better. And, I do. And that's not because he's on the other side of the aisle or because he's my opposition. There are good Republicans out there. He's just not one of them.
Well, this teacher certainly supports you in those policy initiatives, particularly as someone who has a mother going through cancer treatments and dealing with those issues. The science alone should answer for them that giving people what they need to help get through these times should be what we're looking at. And the fact that we could actually stop spending as much money on incarceration unnecessarily allows us to repurpose those dollars to helping schools keep safe from COVID and what have you. So thank you and good luck on that mission. We have a couple of questions that are coming in. We have a question from Donna in El Paso, and she'd like to know if you are willing to stand with us in the fight to cancel STAR, particularly considering the high stakes decisions that are made by it and the fact that we've been so disrupted this past year.
Yeah, I mean, I think for sure for this next session, I mean, I think that that's something that we need to be looking at, especially in light of all of the COVID piece. We have to make sure, however, that we're not going to hurt ourselves on federal funding. As you know, it's tied into a lot of federal funds. And so, listen, I think that we have to get people like MJ Hager and others in that are going to understand that that we need change. And so it's not just about what we have to stay at the state level. Our federal counterparts have to aid us on this thing. And STAR is going to be so difficult in 2021. Just looking at this district, for instance, I don't go all the way to El Paso, but I go to Alpine, Texas on the northwest side. I go to Pecos, Texas in Reeves County. And you look at the sheer infrastructure, problems that, children have in getting broadband and fiber out in their communities. They have it entirely different. They have every problem that the urban kid has, and yet they don't have access to the kind of technology that they need to be able to access the education in the right way. And so, Alpine, for instance, has had its surge of COVID cases. It doesn't matter if you're in the big city or in the small town. This thing is real and it's in your community. And we're going to have to look at infrastructure models that are going to, we're going to have to incentivize, we're going to find something, some structure to incentivize that we have the right technology in these rural communities. But I'm absolutely in favor of looking at STAR for 2021 and passing on it, provided that we're not going to shoot ourselves in the foot. And so we need our federal counterparts to echo the same ideas.
Thank you for your answer to that question. Our final question tonight actually comes from one of Alejandra's members in San Antonio, so I hope he can vote in Senate District 19. Tim is asking, how do we find information on where to vote? And to answer that question, I'd like Rob to bring up the aftvotes.org page. Tim, you could go to aftvotes.org and put in your name. Rob is going to put in his own name and information, and each of you out there can do the same to find information about who's on your ballot, who's up and which races you would be voting in. And once you find out who the recommended endorsed candidates are, it will take you to a choice of whether you want to vote in person or vote by mail. If you choose the in-person tab, you'll find a place to vote. Look at your calendar. Pick a date that works for you. Choose that spot. Choose your location that you want to go vote. And you will be provided then time, calendar, text message reminders so that you're able to complete your voting opportunity. It's really very easy, and we want to make sure that everybody who has not had the opportunity to vote early, like so many Texans who have broken records that we could have only imagined before early voting started, is go to aftvotes.org, check your information, make sure that you have your identification, make your plan to vote, make your voice heard. Safety is most certainly on the ballot in Texas right now, and we have a once in a lifetime opportunity to make the change that we want to see. If you don't like the decisions that are happening in our schools and are happening across our state right now, then maybe we need to get out and make change so that we no longer have one party rule. Because frankly, that one party over the last several decades has proven to us they are not capable of making the decisions to keep us safe and help our schools function to the level that they need to be. It's time to give someone else a chance. Vote them out. Let's move forward. TexasAFT.org/election 2020. AFTvotes.org is your way to make your message heard. Thank you very much for joining this evening. Representative Gutierrez, President Lopez, thank you for spending your time with us this evening. We thank you for your service to our members and to public education and to our state.
Thank you so much.
Thank you.
This is Zeph Capo, President of the Texas AFT, signing off this evening. Get out and go vote. Take care.
Thank you so much. That was great. Appreciate you.
Thank you very much. I think we're still live, Rob.
Good night.
Good night.